we're going to do the call for data partners. We're going to have Yongqi from Peking University to pitch his study and do a call for data partners. Yongqi, over to you. Let me know when to flip the slides, okay?
Okay. And so, hi everyone, this is Yongqi Zheng from Peking University. And today I'd like to briefly introduce our multi-database observation study and invite data partners to help run the cohort diagnostics and, if feasible, participate in the subsequent analysis. Next slide, please. For type 2 diabetes, metformin remains the fundamental first-line therapy. GLP-1 rates are increasingly recommended, either as monotherapy or add-on, for patients with established CVD, CKD, or obesity due to their cardio-renal benefits. However, there are safety concerns related to delayed gastric emptying, including potential risks of gastroparesis and intestinal obstruction. The current evidence is conflicting. Some large observation studies reported increased risks, while others did not. And no RCT has specifically targeted these GI outcomes for GLP-1 rates. This motivates the need for robust real-world evidence, ideally across multiple databases with consistent cohort definition and diagnostics before estimations. Next slide, please. Our primary objectives are to compare the risks of gastroparesis and intestinal obstruction among new users of GLP-1 rates versus DPP-4 inhibitors and SGLT2 inhibitors. As secondary outcomes, we will also assess acute pancreatitis and nephroid to provide a broader view of digestive system safety. Next slide, please. And our study structure is that exposure to GLP-1 rates have a different risk of experiencing gastroparesis or intestinal obstruction within the end of continuous observation relative to DPP-4 inhibitors or SGLT2 inhibitors among the population with type 2 diabetes and history of metformin. We focus on adults 18 or older who have type 2 diabetes, who have at least 1 year of prior observation, and who have at least 90 days of metformin use before starting the study drug. We exclude anyone with T1DM or secondary diabetes, anyone who previously used one of the study drugs or initial combination anti-diabetic therapy, anyone with prior insulin use, and anyone with a history of pancreatitis, digestive system cancer, or abdominal surgery. We also exclude patients with renal dialysis, kidney transplant, or end-stage kidney disease. The study uses a new user active comparator design. The target arm is people who start a GLP-1 race, and the comparator arms are people who start a DPP-4 inhibitors and SGLT2 inhibitors. The primary outcomes are gastroparesis and intestinal obstruction. The secondary outcomes are acute pancreatitis and nephroid. And next slide, please. And all links and contacts are listed on this slide. You are very welcome to join and run the cohort diagnostics with us. And thank you for your considerate participation. And that's all. Thank you.
Thank you, Yongqi. For those of you who don't know, we have bi-weekly meetings for this specific study. Next one is coming up next Tuesday. You're more than welcome to join us at the Teams channel. Thank you, Yongqi. For purposes of time, I will hand over to the floor to Cheng now so that she can provide a overview of the study from Fudan University. Cheng?
Hello everyone. I'm Zheng from Fudan University. Today, I'd like to introduce a multi-center study led by Zheng. This study used the OHDSI framework with standardized analysis methods to explore how fasting plasma glucose levels relate to the number of hospitalization days. I divide today's presentation into 3 parts. Next slide, please. First, let's talk about the study background and why it matters. LPG level is a key indicator of metabolic health. Past studies have shown that abnormal LPG levels, whether too high or too low, are linked not just to diabetes, but also to other health problems like inflammation, and they can exacerbate chronic diseases. These problems can lead to more hospital visits and longer stays. Next slide, please. However, there is still a lack of large-scale multicenter research that systematically looks like how LPG levels relate to the local number of days patients spend in the hospital each year. There where our study comes in. Our goal is to provide scientific evidence for better blood glucose management and the smarter use of healthcare resources. Oh, next slide, please. The second part is about the study design and the methods. Let's start with who we are included in the study. First, patients must be 18 years old or above, regardless of gender. Second, they must have a record of LPG measurements during their hospital stay. This measurement needs a validated number, a timestamp, and be in either milligram per deciliter or millimoles per liter, and LPG can't be zero. Also, patients need complete hospital records, including both admission and discharge dates. Additionally, they must meet at least one of 2 extra criteria: either they were admitted to a specified clinic department or they have had more than one hospitalization episode. Who will we exclude? Patients with incomplete hospitalization records or those whose hospitalization dates far outside the past 5 years. Next slide, please. We have constructed 2 study cohorts using OHDSI standardized tools, which include relevant concepts, one focusing only on LPG data, and the other on glucose measurements taken during hospital stays. For example, we'll look at patients who had at least one LPG measurement in fixed continuous observation period starting from the event and analyze their medical history characteristics. We'll also look at patients who had an inpatient or ER visit accompanied by a glucose measurement during the same clinic encounter and check their medical history too. Next slide, please. We'll use OHDSI cohort diagnostic tool to make sure the data we use is suitable. You can find the cohort definitions for our study on the OHDSI website. The cohort diagnostic package we use is available on GitHub. This study relies on real-world data, and we need your help. If your institution has electronic health records, especially records with LPG measurements and the lines of hospital days, we'd be thrilled to have you join this multi-center study. If you have questions or want to collaborate, you can send resource or ask for technical help via this email. Our team will put together all the analysis results from different centers. That's the end of my presentation. Thank you all for your attention.